analytic music therapy, behavioral music therapy, neurologic music therapy. These are just a few of the different approaches to music therapy that we're going to be covering in today's video on music therapy methods, so stay tuned. Hey guys, I'm Leela from Uku-Lela Therapy. I'm a board-certified music therapist and licensed mental health counselor, and I use music and expressive arts in fun, creative, and research-based ways to help with mental health issues, wellness, and self-development. Today we're going to be talking about the different methods to music therapy. Just like in therapy, there's a lot of different approaches that people might use, like cognitive behavioral therapy or dialectical behavioral therapy. So the ones we're going to be talking about today are behavioral music therapy, analytic music therapy, neurologic music therapy, Bonny method of guided imagery and music, and Nordoff Robbins music therapy. I'm going to start the one that I was mainly trained on, and the one that typically influences my videos, my approach to music therapy on this channel, and that is behavioral music therapy. So behavioral music therapy combines behaviorism and music therapy. So if you think Pavlov's dog, reinforcement, rewards, shaping, and often the goals for this approach are to build more skills, to reinforce positive behaviors, and shape behaviors. A few key elements of this approach are behavioral analysis, so conducting assessments and identifying goals and things like that. Targeted interventions, this is when the therapist implements these goals, and some examples might be to reduce anxiety, to improve positive social interactions, to improve focus or attention, etc. And the sessions in this approach are typically pretty structured. There's a treatment plan, there's goals, there's planned out sessions, yet the therapist still adapts and is flexible to the individual according to what their needs are. Another part of this method might be collecting data or making notes of the behaviors and things like that. So I picture this technique as like pretty structured. There's goals, there's a plan. Some of the populations that this might be the most effective for are in schools, in mental health facilities, or in rehab centers. The next method I'm going to talk about is called analytic music therapy. This one I actually didn't know a whole lot about until I started researching it more, and I found it absolutely fascinating. This is a certification. You must already be a board-certified music therapist, and then you go through a certification process to become an analytic music therapist. And this approach combines psychodynamic techniques with music therapy. So some techniques used in analytic music therapy might be improvisation, music listening, discussing lyrics, or creating music together. And this approach focuses a lot on the relationship between the therapist and the client. Some goals might be to gain insight and explore emotions and resolve inner conflicts and express repressed emotions. So I did say goals, I use that term loosely because in this approach you don't really set goals before the sessions. I picture this approach as very fluid, very flexible, very present moment, and you kind of work with whatever comes up. The next method I'll be talking about is neurologic music therapy. And this approach combines neuroscience combined with music therapy. It focuses on cognitive, sensory, and motor function issues that might be caused by neurologic disorders or injuries. It focuses on understanding how the brain processes music, which areas of the brain are activated during music, and how this processing can be used to stimulate or retrain neurological pathways. This approach might be best for people who experience Parkinson's, traumatic brain injuries, strokes, or multiple sclerosis. So an example of how this might work is after a stroke, some people might have trouble with their gait or their walk, and so the music therapist might use techniques to implement music and rhythm to help retrain the neurological pathways for gait training and to help with the rhythm of walking, which is super cool, and I think that is amazing. The next form of music therapy that I'll be talking about is the Bonny method of guided imagery and music. This is a form of music therapy developed by Dr. Helen Bonny. It combines guided imagery and music to facilitate exploration of emotions, memories, and personal insight. So a typical session using the Bonny method might look like the therapist gaining a rapport with the client, making the space feel safe and comfortable, explaining the process, and ensuring that the client feels relaxed and open. The therapist will then select music and engage the client in some relaxation. As the music plays, the therapist will guide the client through a series of imagery prompts and ask open-ended questions like what emotions are coming up for you, what do you see or feel as you're listening to this music, are there any memories coming to mind, and the client is encouraged throughout the session to express what's going on for them. After this part is completed, the therapist and the client will then process what happened and what insights they might have gained and how they can use it moving forward. The last method that we'll talk about is the Nordoff Robbins music therapy approach. And this approach focuses on the belief that everyone has the potential to respond to music, regardless of their age or ability. It was developed by Paul Nordoff and Clive Robbins in the 1950s. So this session might look like first the therapist and client building rapport, and the therapist getting an idea of the client's musical preferences and their responses to music, and just get a feel for their individual interests. Then there will be the musical interaction part where maybe they will play music together or improvise together. This also might involve musical dialogue, so the therapist might play something and then the client might play something in a response to that, and then they'll kind of go back and forth, kind of like communicating but with music. Afterwards, they kind of process what happened and talk about what feelings came up for them, what it was like for the client, talk about any insights that might have been gained. So basically, the music is being used as a form of communication between the client and therapist. And this will help the therapist develop goals moving forward with the client. Some of the main goals in this approach might be to facilitate meaningful musical experiences, promote emotional expression, social interaction, and just overall well-being. Now, there are more approaches, but these are kind of the main ones that I found show up the most. And I think it's important to note that a lot of music therapists might get into this mindset of like, this is the right way to do it. This is the only approach that I'm going to use because it's the only effective one. And I think it's great to focus on one approach, but I also think that understanding that different people have different needs, and one approach might work really well for one person and one approach might not. One approach might align better with a therapist's goals and values. Maybe in the future I'll do more detailed videos on these individual methods, but there's kind of an overview for you of a few of them. I appreciate you watching. If you enjoyed this content, please like, share, and subscribe to see more videos like this. I post videos every Friday on music therapy, mental health, expressive arts, and fun stuff like that. Thank you so much for watching, and I hope you have a great day.